Hello, my name is Diogo Martins Branco and I'm a medical oncologist at the Portuguese Institute of Oncology of Lisbon. I'm first author of a paper published in ESMO Open, which looks at the aggressiveness of the care cancer patients get at the end of their life. At the time I did this study, I was doing a master course in palliative care at King's College London, and I became particularly interested in investigating the end of life of cancer patients dying in hospital. This is the most common place of death in many countries around the world, including Portugal. Although cancer has one of the most predictable disease trajectories, prognostication can be particularly challenging, resulting in potential overly aggressive treatments that may compromise the quality of life at its end. Therefore, this concept of aggressiveness of cancer care at the end of life is a matter of growing concern globally. Our study aimed to identify risk factors associated with the aggressiveness of cancer care at the end of life for cancer patients dying in hospitals. It was a joint venture of a team of 9 clinicians and researchers involving cancer centers and academic institutions. We were funded by the Carlos Gulbenkian Foundation and the Portuguese League Against Cancer. What did we do? We conducted a retrospective analysis including all adult cancer patients who died in public hospitals in mainland Portugal in a period of 6 years, from January 2010 to December 2015. The aggressiveness of cancer care was measured by the presence of at least 1 out of 16 individual indicators during the last 30 days of life. We identified these indicators from the literature, validated by our panel of clinicians. They included factors related with hospital admission, anti-cancer treatments, and invasive procedures. The study included over 92,000 patients with a median age of 73 years. 62% were male and 53% had a metastatic solid tumor. We found that 7 out of 10 patients were exposed to overly aggressive care at the end of their life, and this prevalence remained unchanged during the 6 years studied. The most prevalent indicators were more than 40 days of length of stay in the hospital and surgery in the last 30 days of life. Older age, metastatic disease, and breast cancer were associated with less aggressiveness. In contrast, higher comorbidity burden, gastrointestinal and hematological malignancies, and death at cancer center or hospital with medical oncology department were associated with higher aggressiveness. We found no association between the existence of hospital palliative care services at the hospital where the patient died and the aggressiveness of the care they received. The study does not allow us to conclude to what extent the intensity of the care is adequate or reflects the preferences of patients and families. However, it helps us to understand important features of the cancer care people get at the end of life. It's one of the few nationwide studies in Europe on this matter. We found aggressive care is highly common, and we also identified subgroups of patients who are at higher risk, for whom clinicians should integrate prognostic estimations to help them better plan patient care, ensuring it aligns with patient preferences. Finally, improving hospital palliative care services could help us reduce aggressiveness of care, particularly in cancer centers and hospitals with medical oncology department. We hope our findings help oncologists in Europe and beyond improving care for their patients. We dedicate this study to our team member and colleague, Dr. João Freire, who sadly passed away this year.